Come in.
I'm washing my hands. Hello, Mr. Hoffman. How are you?
I'm doing well, thank you.
My name is Nancy. I'm a nurse from Harper. How are you feeling today?
I'm feeling very good today.
All right. Can you tell me your name and your date of birth?
My name is Dwight Hoffman. I was born on 1/22/57.
Okay. And can you tell me what year it is?
Currently, we're in the year 2015.
And who is the president?
Let's take the thing. Obama.
And who's your favorite president? Obama? You can say no.
I'm sorry. Yeah.
Who's your favorite president?
Of all time, Reagan.
Oh, okay. And tell me where you are.
I'm at the Harper Hospital.
And why are you here?
I'm here to be assessed from head to toe.
Oh, okay. All right. Thank you. I know those sound like silly questions, but as I'm asking those questions, I'm aware that his speech is clear and appropriate. His level of consciousness is that he's awake and alert. His cognitive function is that he is oriented ×4, person, place, time, and situation. And I also noticed just on first appearance that his skin color is appropriate for ethnicity and his ABCs are intact. Then we would proceed over and get your height and your weight, and then you would use this chart to calculate the BMI. So your height is 5'11", is that correct? And
Correct.
you can be any weight you would like. What weight would you like to be?
181 pounds.
Okay, so that puts you at a BMI of 25, which is actually in the overweight category. And then we would step over 20 feet from the Snellen chart, and we would check the vision in both eyes, each eye separately with the eyeglasses on, and with your glasses your vision is 20/20, which means that at 20 feet your eye sees what the normal person can see at 20 feet. Then we would proceed with vital signs, taking the radial pulse, the blood pressure, the respirations, and the body temperature. Then from there we're going to proceed, I'm just going to start with the head to toe. And I see that your head shape is normal and round, and it's an appropriate size for your size person, and that's called normal cephalic. And I'm palpating the skull and also the scalp, looking for any lumps, bumps, protrusions, or indentations, and then also checking the scalp for any lesions or problems in the scalp and any infestations, and doing that all over the whole scalp. All right, I'm also looking at the face for symmetry. I'm looking at the eyebrows, the eyes, the nasolabial folds, and the corners of the mouth, and I see that they're all symmetrical. Can you smile and frown? And then close your eyes really tight. Good, and I see that that's all symmetrical, and that indicates that cranial nerve number 7 is intact. So from there, I am going to, can you take your glasses off for just a moment? I'm going to press right here at your maxillary sinuses, and right here, your frontal sinuses. Do you feel any pain with that? You should just feel firm pressure. All right, and I'm checking the temporomandibular joint. And can you open your mouth really wide and go side to side? You feel any pain with that?
No.
I don't feel any crepitation. You can put your glasses back on. Oh, actually, no, you can't, because I'm going to look at your eyes. So now I'm going to look at the eyes, and I want you to keep your head still and just look at this. And I'm going to lead your eyes through the 6 cardinal positions of gaze. And I see that your extraocular eye movements are intact. So that tells me that cranial nerves number 2, 3, and 6 are intact. And I want you to look right here as I bring this in. And I see convergence of the axis of the eyes and constriction of the pupil. That is normal. And then look straight at me. I'm checking the light reflex, and I see that the pupils constrict. Good. So that's all normal. And I want you to look up for me. And just keep your head here. Just look at your eyes up. And I look at the sclera, which is china white and glistening, and then I'm looking at the conjunctiva, which is pink and moist, and that is normal. And then you can put your glasses back on. I know you're more comfortable with your glasses on. Good. And then I'm going to check your ears. I'm just palpating the pinna. Any pain or tenderness?
None.
And I do not see any problems with the skin. I don't see any extra cerumen at the canal. And I'm going to I'm going to whisper a couple words. I want you to repeat them.
Cubs game.
White Sox are great.
The White Sox are great.
Wonderful. So your gross hearing is intact. Now I'm going to move on to your nose. I'm just going to touch your nose here. I'm just palpating. And the nose is in the midline. I don't see anything abnormal there. The skin is intact. I don't see any problems. Can you close one nostril and breathe in through the other? And then do the other one? Any problem with either of those?
No.
Okay. And the septum is in the midline. Okay, good. So now we're going to move down to the mouth and the throat. I'm going to put my mittens on here for this part. Any problems with your teeth or your swallowing or chewing?
No, my teeth are working real well these days, and the swallowing and chewing seems to be very regular and proper.
Okay, so I look at the lips and they're pink and they're moist. And then can you open your mouth for me, please? And then I'm looking at the buccal mucosa, which is glistening and pink. I look at the teeth and the gums, which are pink and intact. All the teeth are present. I see there's some fillings, but I don't see any open cavities. I'm looking at the hard and the soft palate. Can you stick your tongue out a little bit? I see the top of the tongue is pink and rough. Can you lift your tongue up? And I see the underside of the tongue is pink and glistening. And I for sure want to look in this area under the tongue because that's where oral cancers a lot of times start. And then last thing, can you say ah? So I see the uvula and the soft, that's good. The uvula and the soft palate go up. That's checking cranial nerve number 9 and 10. And stick your tongue out. That is in the midline, so that's checking the function of cranial nerve number 12. Okay, now we're going to proceed with looking at the neck. And I'm first going to look for any enlargement of the salivary, the parotid glands, the salivary glands, and then the thyroid, which would be down here at the base of the neck. And I want to check range of motion of your neck. So can you put your chin to your chest and look up, and then look side to side, and put your ear to your shoulder, and your ear to your shoulder. Good, your range of motion is intact. And I'm checking cranial nerve number 11. Can you shrug your shoulders up? Good. And move your chin against my hand. Wonderful, fantastic. So cranial nerve number 11 is intact. Now I'm going to check the lymph nodes of the neck. So I'm going to use the pads of my fingers in a circular motion, the preauricular, the postauricular, the submental, the submandibular, the jugulodigastric, the superficial cervical, and the deep cervical chain, the posterior cervical, and the occipital back here on the occipital bone, and the supraclavicular. Can you shrug your shoulders up? Right in here for the supraclavicular. And then with the neck, I'm going to check the carotid pulse on each side. And I feel the carotid pulse is a normal strength, that's 2+. The rate is within normal limits, and the rhythm is regular. I check the carotid pulse on the other side as well. The rate is regular, the rate is within normal limits, the rhythm is regular, and the force is 2+. And I'm going to listen to the carotid arteries with the bell to check for a bruit. So can you take a breath in and out? And hold. And breathe. And hold. Good, and breathe. I hear the pulse, but I do not hear any bruit. And then moving on to the upper extremities. Can you hold your arms up for me? I'm looking at the skin. I'm checking the temperature, and I see that the skin is intact. The color is appropriate for ethnicity. I'm looking for any lesions or ulcers, checking for any edema by pressing where the bones are, which I do not see. I'm looking at the fingers, at the fingernails. The beds are pink and they're firm. and the capillary refill is brisk, less than 2 seconds. I'm looking at the finger for the profile sign, and the angle is less than 160 degrees. And then I'm going to check strength. Can you hold your hands like this for a count of 10 seconds? 1, 2, 3, 4, 5, 10. Good. And can you squeeze my fingers hard as you can? No. Squeeze like this.
Oh.
Squeeze my fingers. Squeeze my fingers as hard as you can.
I don't want to hurt you.
You're not going to hurt me. Squeeze, 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 squeeze. Okay, good. Your hands are strong. Now you can let go. All right. And then pull up. Pull up. Good. And push. Okay, good. Do the same with this hand. Pull up. Good. And push. Good. And you have equal strength in both upper extremities. Fantastic. You can relax your arms. Moving on to the respiratory assessment and the chest, I'm looking at the breathing. I see that the breathing is relaxed and easy. There's no use of accessory muscles. There's no bulging or any pulling at all on the interspaces. And I see the chest is symmetrical. I'm also going to look at the chest posteriorly, and for the same thing, I'm looking at the chest, seeing if there's anything abnormal, is it symmetrical? And while I'm doing this on the chest, both anterior and posterior, I'm also looking at the skin. So this is a common area where you find a lot of moles and a lot of freckles. So macules are freckles, and elevated nevi, moles are macules. So I see a lot of moles on the chest, both anterior and posterior, and if you were to see anything suspicious, you would want to follow up with that. Okay, so continuing on with the breathing, I'm going to listen to your lungs. So I want you to breathe a little bit deeper than normal, and with your mouth open, in and out through your mouth. Okay. Good. Now can you turn just a little bit this way? Like put your feet over there. There you go. And now I'm going to listen in the back. Big breath. And I'm going to have you lift up here because I'm going to listen underneath. Relax. There you go. Big breath. And again. Okay, we know there's 2 lobes on the left. And then can you come back here? And there's 3 on the right. Can you turn a little bit that way? Just lift up. We're going to lift. Big breath. Good, and you can come back straight. So the lung sounds were all clear. I heard bronchial breath sounds here, bronchovesicular here, and then vesicular in the periphery. Same in the back. There was bronchial, vesicular breath sounds towards the spine, and then vesicular in the back. All right, now I'm going to have you lay back. Actually, I'm sorry, you're going to sit up here for just a minute. We're going to move on from there to the breast assessment. So I'm first looking at the breast for size and symmetry, for anything abnormal. So if you can have your arms at your side relaxed, and then also put your arms up over your head, and then also your arms on your hips and make a muscle. Good. I'm looking for any retractions or dimpling of the skin while those maneuvers are being done. And then I'm going to move on to assessment of the axillary lymph nodes. So I'm going to have him relax his arm, and I'm going to check out here are the lateral, and then remember all the lymph nodes are up in the axilla. So here's the pectoral are towards the front, the central just deep in the axilla, and then the subscapular are towards the back, but all in the axilla. And seeing as our client is very ticklish, I'm not going to do it on the, I want you to do this on both arms. I don't know if we're going to make it through both arms. Here's lateral, and then here is the central, all the way deep in there, and then the the pectoral, and then the subscapular back here. You did good. You did good, buddy.
Thank you.
All right, come on back. Way back. All right, I'm going to continue on with the breast assessment. And what I would do is we're going to start with the right breast. I'm going to have you put your hand up under your head, and I would put here a small pad that helps to spread out the breast tissue so that it can be assessed. And then you will use the model, and I'm going to palpate starting with the tail of Spence, light, medium, and deep, using the pads of my fingers. And I'm going to go all the way down all of the breast tissue. And I'm using the vertical strip method, which is the method that is recommended today. And it's hard because my breast is escaping. It's running away from me. All right. And I see there is a lump right here. I'm going to continue with my assessment, and then I'm going to describe that one lump. All right, so here's where I feel the lump. If this was the right breast, okay, and this was noon, it's at about 5 o'clock, and it's hard. It's about 1/4 centimeter, and it's round. All right, sir, you can put your arm down, and we would do the assessment obviously on both breasts. At this point, I'm going to look at your neck again, and I'm going to have you turn your head to the left, and I'm looking here at the veins in the neck to see if there's any bulging of the veins, which I do not see. His jugular veins or the veins in the neck are flat, which is normal. All right, and we're going to move from there on to listening to the heart. Just breathe normal. I'm listening in the aortic, the pulmonic, the tricuspid, and the mitral area. And then I'm going to do the same with the bell. I am listening in the aortic, the pulmonic, the tricuspid, and the mitral. And what I hear is S1 and S2. The rhythm is regular, the rate is within normal limits. I do not hear any extra heart sounds like S3 or S4, and I do not hear any murmurs. And I am also going to listen to the apical pulse, and this is where in clinical practice I would count the pulse. So I do that at the 5th intercostal space, the midclavicular line. And I hear a nice regular rhythm, and the rate's about 70. Then I'm going to move down to assessment of the abdomen. First, I'm looking at the abdomen for contour. It's a little bit rounded. At this point, if you wanted to, you could put the bed completely flat, or at this angle is okay. And then I'm going to come to the foot of the bed, and I'm going to look at the abdomen for symmetry, which I do see that it is symmetrical. And I'm going to look at the abdomen again. I'm looking at the abdomen, looking at the umbilicus, looking also at the skin, any moles or scars, particularly surgical scars. And then I'm looking for any movement. I see normal respiratory movement, and then I also see aortic pulsations here above the umbilicus, which is normal. That is something that we expect. So do you have any pain or tenderness in your abdomen anywhere?
I do not.
Okay, so I'm going to take a listen to bowel sounds in all 4 quadrants. I'm just going to pull down here a little bit. So I'm going to start. Your book says to start in the right lower quadrant. You can start, doesn't matter, as long as you listen in all 4 quadrants. And I hear normal vowel sounds in all 4 quadrants. Then I'm going to do light palpation all over the abdomen, pressing down about 1 centimeter. Let me know if anything feels tender as I'm doing that.
Okay.
So I want to make sure that I cover the whole abdomen all over. And I'm going to say his abdomen feels soft, which would be normal. Now I'm going to press a little bit deeper here.
Okay.
I do not feel any masses or lumps or anything abnormal.
Nothing hurts.
All right, good. So nice, normal, soft belly. All right, good. And then I'm also going to listen to vascular sounds, which I could do, you can do before you palpate. So I'm going to listen to the aorta a few inches above the umbilicus. And then I'm going to listen to the renal arteries right across from there. And right across from here. And I do not hear any vascular sounds, which is normal. You might hear the pulse, but you may not, but you should not hear any bruit. I did not hear any bruit. And then I'm going to move down to the lower extremities. I'm looking at the lower extremities, looking at the color, which is appropriate for ethnicity. I'm checking the temperature all the way down to the feet, which is warm. I'm looking and noticing that the hair distribution is even and appropriate and symmetrical. I want to look at the back of the legs for any venous pattern, varicosities. I see a little varicosity here, but none here. Sometimes people with more fair skin, you can see the veins, but it may be a normal pattern. So what you're looking for is any varicosities. And I just saw that one small one there. All right, and so all the way down to the feet, I'm looking at the toes, I'm looking at the toenails. All right, the nail beds are pink, they feel firm. The capillary refill is brisk, it's less than 2 seconds, and I'm doing that on all the toes, on both sides. And then I want to check the pedal pulses. The rate is within normal limits, the rhythm is regular, and the strength is normal or 2+. Good. And now I want to check the strength of your feet and your legs. Can you press against my hands? Good. And pull up against my hands? Good. And then can you lift this leg up off the curtain? And I'm going to count to 5. 1, 2, 3, 4, 5. Good. And then I'm going to have you pull this one up. 1, 2, 3, 4, 5. Good. And then can you bring your leg out this way? Good. And this way? That's good. And bring it that way. Good. And then can you bend your knee up? All right. How far can you bend your knee? Good. That's normal. And then same with this one. How far can you bend your knee? Good. And all the way down. Fantastic. All right. So that's done with the legs. I am going to do one piece of the neuro assessment, though, at this point, because he's in an appropriate position, and that's the Babinski reflex. So the Babinski reflex, up the bottom of the foot, and the normal response is to curl the toes, which would be negative or normal. Or for people who are ticklish, they just pull their foot away. Sit up. All right, doing great. Okay, I'm going to do some fun tests with you now. You close your eyes. Just close your eyes. And I'm going to use a little cotton wisp. I want you to tell me when you feel it. Just say now.
No. 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 No.
All right, good. You can open your eyes. And now we're going to do a test where you're going to distinguish between sharp and dull. I want you just to open your eyes for a minute. This is sharp.
Yep.
And this is dull.
Got it.
All right, so close your eyes. So just say dull or sharp.
That was dull, I think. Sharp. Dull. 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 Sharp. Sharp. Well, I think that was dull. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Dull.
All right, good. And then I'm gonna check some reflexes. So if we just try to relax, actually, can you make a, there you go. All right, just try to really, really relax your arm here for me. All right, I didn't see his fingers move, but I sure felt that tendon jump when I did that. So you wanna do that on both arms. Make a, there you go. And try to relax really well there. Good. Okay, and then we check the patellar reflexes, which I just see a tiny move there. Okay. All right, and then can you stand up for me? And then towards the wall there, I want you to take a couple steps, regular steps. Just walk, and then turn around and walk heel toe, heel toe. There you go. All right, good. Stop. And I see that your gait is normal. And then I want you to close your eyes. This is the Romberg test. I'm just checking to see if you can stay there with your eyes closed, which you can. Okay, you can open your eyes now. Good. And then I want you to touch your finger to your nose and then touch my finger. Okay, quickly. As many times as you can, quickly. All right, good. Now you can hold on here, and I want you to go like this with your shin. And the same with the other side. All right, good. So I see that his coordination is intact. Now I want to look at your back. So I'm looking at the spine, and I see that the spine is straight. I'm checking that by looking at the symmetry of the shoulders, the scapula, and the gluteal folds. And I'm also palpating. Any pain in your back?
None.
And then can you bend over and touch your toes? And I see his spine is nice and straight as he does that. Come on, back up. And then from the side, I see that he has the correct convex curvature of the thoracic spine and concave of the lumbar spine. And then can you turn to face me? And then I want you to just twist your spine, not your hips. Twist and look at the wall, not your hips.
Oh.
Just your upper back. Just turn, there you go. I'll turn the other way. Good. All right, fantastic. You can have a seat. I think we checked out everything, and that concludes the complete physical assessment.